You are listening to the Spine Whisperers podcast. Please know that our doctors are here to only educate, not diagnose on this podcast. If you have any questions, please feel free to find us at www.mfwellness.org. Hello, and welcome to Spine Whisperer Podcast. Myself, Dr. Matt, Dr. Brad, and Dr. Danielle. Today we'll be discussing the benefits for IASTM, and that is basically instrument-assisted soft tissue mobilization. And it is a hot topic now for us because we've been using it, and Dr. Danielle especially been using it so much more than we have previously. So we're just going to kind of go into details on what it is and why we should be using it in the first place.
Yeah, some of you, in terms of patients, have maybe had it done to you, but others you've maybe just viewed it being done to other patients in the office. So we want to kind of clear up what it's all about and why we do it and all that good stuff.
Yeah. All right, so Dr. Danielle, what is it?
So essentially, it's the use of these metal tools to free up muscular adhesions. Adhesions also found in tendons and ligaments too.
And does it have to just be metal, or can you use plastic? Or
for this technique, typically they're metal. If you were to use something plastic, you probably wouldn't get the results you need.
And then can you do that strictly metal on skin? Can you do it through the clothes? How do we know that we need it done to us?
Okay, so you can definitely do it through the clothes. If you do it that way, you really want to make sure they only have like a t-shirt on or one pair of pants, because if they have a coat on or really thick pants, you won't be able to get through to the muscle. Skin on skin, the tool is fine too, but if you do that, typically I'll pair it with biofreeze, so it's not just friction and the patient doesn't feel like their skin's just ripping off.
Okay.
And
that's not good.
No. And then you know when to do it when a patient has more than just bone stuff going on, if that makes sense. So more than just joint-related issues where you adjust them, the adjustment feels good, but it still doesn't feel like their pain is resolved.
And where did you learn to do it?
At Logan University.
Is that a special course? And why did you kind of want to learn it?
So we all had to take the intro course for it.
Okay.
And learn a little bit about scraping. I pursued it because I found the benefits of it with myself. I had scraping done to me when I was at Logan University, especially as an athlete. And then over the past first year of practice, I just kept coming in more and more to play. I never thought I would go that route.
Right.
I thought I would adjust, do rehab exercises, and send people on their way, but it just became more prominent.
And so scraping, that's the term that's used for using that metal instrument and basically breaking up adhesions, we'll call them, or how would you describe that?
Yeah, so the scraping is just like you would think if you took a tool against anything, scraping motion, and it's essentially breaking up adhesions. It's lengthening muscles, lengthening tendons and ligaments.
So there's like 4 or 5 different tools that I've seen you use. Can you talk about the implement and the beveled edge and which side? Like I know I've noticed on one of the sides is more of a rounded edge, and one's more of a almost a straight edge where you can use to push out fluid.
Mm-hmm. Yeah, so the beveled edge is that we were talking about, that edge where it looks like you can use it to push out fluid. That's what we want to do. A lot of times with these adhesions and muscular issues, there's swelling and fluid that sits in those areas. So that's where we use that beveled edge to help push it out. Some of the other tools, they'll have a really sharp point on them, or they'll have just a small curvature. And so with those, depending on the patient and their anatomy, is how I base off my tool selection.
So if we have someone out there who's like, oh man, that sounds like something I need done because I've had these muscular issues. First of all, we kind of joke about this in the office, but is it something that always hurts to be done?
It's definitely not for the faint-hearted. It is an aggressive therapy. It more than likely will always hurt. Eventually, patients get to the point where they're either used to it or they're healing. When they're healing, the soft tissue therapy isn't that aggressive. nor does it generate that much more pain. And it's not so painful as it was that first day we did it. It also depends on patient tolerance. I have a lot of patients who don't blink an eye when I do it, and I have a lot of patients who are tearing up when I do it. So it just depends.
Some squirming.
Yeah.
Some foot tapping, some trying to get away from you.
And there is a bit of a phrase going around the office, and I think you even have a shirt. What does that shirt say?
That shirt says, "If you're not crying, I'm not trying."
So there may be a little discomfort, but I know athletes love it because it can mean they can get back on the field or at least performing at a higher level quicker when they have this done to them. But I also know that you warn them sometimes that, hey, this may bruise, you may need to ice this. What does it mean when they get that bruising, and will it bruise every time?
So the bruising, it's a hit or miss. Some patients either bruise a lot, and some patients don't bruise at all. Even when I warn them that they'll bruise, sometimes they'll come back in and say to me, "Hey, I didn't bruise at all." And they almost insinuate like it wasn't hard enough, but that's not necessarily the case. So when there is bruising, that's because the muscles I'm working in have held on to inflammation and, if you want to say, bad blood in those muscles. And so when I go through and scrape, it releases all that out, brings it to the surface, and the lymphatic system drains it out.
And so they should probably drink a lot of water as well?
Yep, a lot of water and icing afterwards.
Yeah.
Along with, I know at the very beginning we were talking about how you kind of got into scraping and how when you first thought you're like, hey, I'm going to do adjustments and rehab and this is going to be great. And you kind of found yourself like, well, this scraping thing is pretty cool. And it really has made a big difference on a lot of the athletes that I'm treating. So when we talk about subluxations, how does scraping affect the muscles that are linked into those bones that we're adjusting as well? Do we want to do scraping before the adjustment? Now, I know a couple of your patients, you will do scraping while they're on the table stretching. So kind of how does that scraping ideology fit in with subluxation?
So it really depends on what I'm scraping and what I'm adjusting. So if it's their lower back that needs to be scraped, typically I'll scrape that before I adjust it to help those muscles calm down, to give them some relief and make the adjustment nice and smooth. Now, if it's their knee that we need to do the scraping towards, I'll adjust their spine and all that and then go back to the knee and scrape from there. So it really just depends on where it is in regards to the adjustments being performed.
And obviously we're seeing this being done in the office, or patients are seeing it done more in the office because you're here and that's one of your go-to things, one of your tools. But why do you think we're seeing so many people who need scraping, or is there a certain population of people who you perform scraping on more than others?
So, back in the day when chiropractic first came about, it was all about adjustments and joint restrictions and subluxations. And now the world we live in, we do a lot more. Athletes are out killing themselves every day. We have people sitting at a desk for 8 to 10 hours, not moving. And so, yes, you need that adjustment component to free up those joints. But, if you're sitting in the same position all day, your muscles are reacting just as well. So that's why soft tissue has come into play with just about everything that we do here. In regards to who I perform it the most on, it's definitely the athletes. It helps them get back to the plane. It helps prevent their injuries. They get a small twinge in their hamstring. I can have it fixed in 2 visits versus if we don't do it and a week later, they're out with a full hamstring tear.
So the history of scraping in general and where it came from started around the same time that Mike Leahy kind of came up with a thing called ART, and they really talked about how to best utilize manipulation of the soft tissue with your hands. Now, I went through a whole bunch of training to do ART with thumbs and so much training.
If you're unaware of what ART is, and you're a patient of ours, if you've ever had us plunge our thumb into one of your muscles and then we make you go through a certain range of motion with that limb, then we're probably doing some type of ART.
Yeah.
So just so you have a background on what ART is, active release technique.
Yeah. And then Grafton, around the same time that ART came about, Grafton was initiated as a finger and hand saver, really, but more of a I need to get this tool in towards this tendon or ligament or muscle, and I need to scrape, I need to disengage that wet newspaper that we call a muscle away from, and being able to actually fully contract and stretch that muscle. So I guess I just explained really the difference between ART and scraping is really the use of a tool.
Good job.
Yeah.
You
Yeah.
asked
Nice
the question
one.
and answered it. Yeah.
It's like, yeah, I was just out
Dr.
there.
Daniel's like, oh, sweet.
Yeah, I know.
Yeah, nice.
Let me off the
Nice.
hook here.
Would you say that's an accurate description, or should we add more to it?
I would say it's pretty accurate. ART, in my opinion, is more of that pin and stretch that everyone refers to, where, like Dr. Brad was saying, you jab your thumb in and you have them go through range of motion to stretch out that muscle. In my opinion, it really just works certain trigger points. It doesn't work the full muscle in itself. Whereas scraping, you can work the full length of the muscle. Like the quads, for example, I can work all the way from the knee to the hip and basically strip it, free up all those adhesions, and send them on their way.
So at this point, you've been in practice a little bit over a year, correct? Mm-hmm. And you've been doing scraping pretty much pretty much the full time. What are some of the best reactions you've had? I know, like we said, we joke, if you ain't crying, I ain't trying. But what are some typical reactions? Just so other patients maybe don't feel weird about how they react. What are some good reactions you've seen?
There's been some tears or tears building up in their eyes. That's pretty common. A lot of people will clench their fists and stop breathing. So clenching the fist is fine, but we really prefer you to breathe and not pass out on the table.
A little bit.
Dr. Matt himself, he was fine, but his trap welted up into a big old knot.
It was like someone stung, I don't know, probably half of my trap, and it just rose, and it was like, that's pretty interesting. And then we ended up lasering it as well, but it was awesome. It was great.
I have been swung on.
Yeah.
Oh,
yeah, I saw that.
Yep.
Yeah.
That was the first. Usually their feet will start going up and down, like they want to kick me, but they won't. And
so somebody did try to kick you though.
Mm-hmm.
It was like
definitely some almost like crawling away.
Yeah.
Yes.
Working their way away from. But even after all those, it is something that's it's worth it. Like the patients who had it, even though it doesn't feel that great, they want it done again because they know how well they've done through that care.
Yeah, so I mean, we've seen Dr. Danielle work on patients and they're unable to turn their head to the left, and she works on them, adjusts their spine, starts doing the scraping and scrapes down through that trap, and it's like they never had a restriction in that muscle. It's pretty cool to witness.
And our young athletes who are possibly worried about missing weeks of the season or maybe even the full season, and they realize that the scraping has helped them get back into on the field and playing again. Like it's well worth it to them to deal with just a little bit of discomfort for a few minutes in order to get back on the field and play again. So
I think as well the correct diagnosis, and like, I'm going to be scraping this part of the anatomy here where it meets where the tendon is inserted into the bone, where the muscle comes down and inserts, I'm going to be scraping this area. Not generalized, nothing like that, but right here, this is where the edema is, this is where the fluid's building up, this is where I'm feeling the trigger point in the muscle. Right here, this is the diagnosis, this is what I'm treating. And it just goes hand in hand in what we do in this office so well. It's like, yeah, of course, this is exactly what's injured, this is where the roll happened, this is where the muscle's injured, this is where it's spasming right now. I just feel like it's such a great thing to have in this office, and to be utilized so freely and so readily with so much knowledge. And it's just really cool. That's my take on it.
Yeah, yeah. Another great tool to have, like especially for us old guys when we have something that our thumbs are tired. Our thumbs are tired, and so we're like, "Hey, Dr. Danielle, how about you check this out?"
Some patients look at me like, "Are you selling me out? Is this it? Is this like it's like
no,
you just give me the Dr. Danielle?" It's like, I had a discussion this morning about why I do ask other doctors to help me. Like, Dr. Brad comes over and helps me sometimes doing different ART, especially into the neck on people that have deep trigger points within that trap. Dr. Brad is probably the best person to work the musculature face up on that side. It's just unbelievable. Same thing with Dr. Danielle. She's just the best at what she does. So I know that I have limitations, and so I need help in some aspects. So that's why I'm selling people out. It's for their own good, really.
And so if you're someone out there who's had muscular issues and you've been getting adjusted and we've been working on things, but you still have some lingering issue, it's definitely something to look at.
Yeah.
Have us like you said, do an evaluation, diagnose exactly what's wrong, and then scrape that area.
The only other thing I would add is don't let the idea of tools or the intensity of this therapy scare you from trying it. Because it is intense, but there's different levels of intensity we can hit. The first time you get it done, we're not going to go at 100%. We'll kind of work your way into it, get you used to it, and also see how you tolerate the pain in itself.
Yeah.
Because like you said earlier, everyone's different. So you're able to gauge that and then build from that baseline up. So.
Yep.
Okay. So for myself, Dr. Matt, Dr. Brad, Dr. Danielle, my email is drmatt@mfwellness.org if you have any questions, and we'll see you soon.
A big thank you goes to Hug Monster Sound for all the hard work they put into making us sound so great.